Hi everyone, this is Christine Espinoza with Helene and Christine's team at Remax Spine Properties, and I am here today with my friend and chiropractor neurologist Mark Burdorf, and he's going to shed some light on the topic of the day, the hour right now, the coronavirus, and is this something that we need to be concerned about? Is this something that everyone well, you can't help but talk about it and think about it, but what's the real deal from someone in the medical profession? So thanks, Mark, for letting me interview you today.
You're welcome.
So can you explain, first of all, there's a lot of chiropractors out there, but I don't normally hear about a chiropractor neurologist. So what's the difference between a regular chiropractor and a chiropractor neurologist?
Well, the difference is there's only 7 of us in the state. And what I did is I was a general chiropractor first, and then I went back to my neurology specialty. I've had that since '95. And my practice emphasis is more migraine, vertigo, movement disorder. I deal with a lot of concussion, traumatic brain stuff. But we are kind of a niche practice. There's only 7 of us in the state.
Oh, wow. That's really interesting. Well, and concussions is something that a lot of people, especially if you have kids playing sports, like me, I have 2 boys, I'll probably end up being in here more than I
That's my everyday.
So back to this coronavirus. Now, is the media blowing this out of proportion, or is this something that we all should be concerned about? And give us your take on the coronavirus.
Well, the media, if it bleeds, it reads. So yes, they are probably blown out of proportion, but seriously, everybody should be concerned about their immune system. And the thing is, if your immune system is weak, you can get a better chance of getting sick, whether it's the coronavirus, whether it's the flu, even just everything in general, getting cancer, heart disease. So there's a lot
even
of
if you're
things.
young and healthy, it doesn't mean you don't have to take extra precautions knowing that this coronavirus is out there, correct?
Correct. I mean, they're talking about children under 10, elderly people, the nursing home, stuff like that. But I mean, everybody, if you've got a weak immune system, is susceptible to it. And it's like, I always make the joke, it's like, you know, if you made it to your dirty 30, you're pretty much, most people are bulletproof to that point.
Okay.
And then after that, you got to start being concerned about your health. And once you get into your 40s and 50s, there's a lot of stuff you can do nutrition-wise to make your body stronger.
Okay, so instead of running out to Costco and buying all the toilet paper and hand sanitizer, what I'm going to do, and when I leave here today, I'll probably have a bag of goodies, is stock up on things that will protect my body and my immune system. Explain what you're telling your patients to do to protect themselves, immune system-wise.
Well, first and foremost, I mean, most people should, after the age of 40, start doing annual blood work. And a lot of people kind of do that when their birthdays, stuff like that. It's like, that's their New Year's resolutions. But right now, because we are kind of going into a crisis, one of the first things I'd recommend you do is just get your vitamin D level tested.
How do you get your vitamin D level tested?
It's just a simple blood test. And,
okay. From your general practitioner?
Yeah, you can go to your primary care, they can do it. We have self-pay prices here as well. But vitamin D, and I know we were talking about half-life, so we don't have time to get into all this technical stuff, but the best analogy I can give you is like, half-life means change, and it's like how long something stays in your body, how long it takes to go out of your body, or you got to replenish it. And just like, you know, everybody's bought or leased a car, and you know, it depends what your schedule is. You might have to put gas in 2 days later, a week later, maybe 2 weeks later, but you need to replenish the system. Okay. And half-lives stay in your body for a certain period of time, and the half-life of vitamin D is 15 days. So my strategy is get your vitamin D level tested, okay? And the level on a blood test should be between 50 and 70.
Between 50 and 70 for just a regular person should have...
Healthy.
Okay.
Now, a lot of times medical doctors say 30 is okay. 50 to 70 is better because it makes your immune system stronger. And I always make the joke, trying to prevent the 3 C's. And now we got the 4 C's.
Okay.
So the first C is if you're trying to prevent cancer, you're trying to prevent cardiac disease, and really the big thing now is cognition.
Okay.
And now the 4th one is the coronavirus.
Oh,
and
wow.
you know, people talk about vitamin C, where yeah, it's good for your bones, but the thing is, vitamin C has a lot to do with regulating your glucose and insulin levels.
And that's all you hear about when people are sick. They say take vitamin C. I don't hear people normally talk about taking vitamin D.
Well, vitamin C is a benefit too, but vitamin D is related to so many things. You want to prevent cancer. There's 15 different cancers. Breast and colon are the big ones. If you're trying to prevent cardiac disease, you're looking at inflammation factors, cognition, once again, sugar, brain, arthritis, all that stuff. But now the whole thing is, if you want a strong immune system, have your defenses up. Okay. Be at 50 to 70, but you know what? You don't know.
You would never know, right? And you're saying, because I'm going to get mine tested, and it's only what, $35? Did you say?
$39.
$39 to get tested. And you know, you think living in Arizona that we have plenty of vitamin D because we get it from the sun. Shockingly, I found out my son, because he broke an ankle and then broke something else, and we got his vitamin D levels tested, and they were so low. And it's like, how is that when we're here in the sun? But it doesn't matter, right?
The problem is if you put sunscreen on, that's going to block vitamin D absorption.
Oh,
so
wrinkles or get sick.
Yeah,
it's like,
wrinkles or get sick. So the thing is, get your vitamin D tested, and then I can tell you, if you're a 200-pound guy versus a 100-pound girl, you're going to need a different amount. But the thing is, you got to test and you got to retest. Because my best analogy too is like when a cop pulls you over for speeding, what's the first thing he always asks you?
Can you give me a warning?
No. How fast are you going, Christine?
Right.
No crying. But how fast are you going? So the thing is, if you know your vitamin D level test, and then I'll tell you, and I get people all the time with the stories. I mean, I have people that their vitamin D levels 10, 11, and they just don't know. Okay,
so once a year, or in times like this, do you think you should test more often?
Well, it's like a Foo Fighters times like this song, right? Sorry,
You're aging yourself.
That, I know. So what the thing is right now, if you haven't got it done, get it done, because that way I can tell you what to do, and then go ahead and do it for 30, 45 days, and then retest to see, is what you're doing enough?
Okay, so you mentioned before, is it 3 or 4 different supplements that you would recommend right now to give your immune system a good, strong boost? Vitamin D, number 1.
Mm-hmm. Actually, it was really 2 supplements, and one is just a product you get at the grocery store. But vitamin D level, get it tested, make sure you're between 50 and 70. There's a supplement called Lauricidin, and what it is, it's called Lauricidin.
I've never heard of this before.
Okay, it's actually manufactured in West Phoenix. And it's made out of something called monolaurin. It's lauric acid. These are again compounds. It's derived from coconut oil, and what it does is, once again, it's very good for boosting your immune system. Okay. The third thing I'm going to tell you to get is always keep a bottle of Dr. Bragg's apple cider vinegar in your refrigerator. And Dr. Bragg's apple cider vinegar is not pasteurized, so it's more enzymatically active. And what it is it's a mild acid, and when it combines with the strong acid of your stomach, it's an alkaline reaction. So if you think you're getting sick, start loading with hopefully get your vitamin D done, so that way you're taking the right amount. And if you need to, you can dose up on that too for short periods of time. But a lot of times, and I know this sounds kind of nasty, but just do like a shot of apple cider vinegar.
I don't think it's that bad. I kind of like it. I don't know. So one shot, like...
Do a shot and do like 4 ounces of water immediately afterwards.
Okay.
Now, just for regular health, do it once a day. If you're sick, you can do it 2-3 times a day.
I was shocked about this apple cider vinegar. My mom would get migraines all the time. And then when she started doing apple cider vinegar every day, it's been years and years since she's had a migraine.
Well, because when your body's acidic, your muscles go into spasm. So that's probably your neck muscles were in spasm, the back of your skull goes into spasm. So if you alkalize your body, you stay healthier.
Okay, and I hear a lot about that, alkalization.
Yeah, it's just like, we'll go back to chemistry. So 7 is neutral, 0 is acid, 14 is alkaline. So your blood has to be 7.43, and if it's not, you're going to go into a diabetic coma or probably convulsions like epilepsy. So your external fluid is your urine, sweat, saliva. If you alkalize that, it creates more balance in the system.
And the apple cider vinegar helps with that.
Correct.
So those 3 things. And should people be going around with masks on their face? What is your idea of mask?
It's kind of worthless, because if you're wearing a mask and you're healthy, you're probably not preventing yourself from getting sick. If you're sick and wear a mask. You're preventing spreading it. But the reality is, if you're sick, go home.
Exactly. Stay home, people, if you are sick.
Yeah, so I mean, the mask is kind of dumb, and the sad thing is people are buying them all up, that even the places that really need them, like hospitals and clinics,
right,
are running a shortage of them.
Right. The only thing I was thinking is a mask would make me stop touching my face, because I didn't realize until I started paying attention how often I'm rubbing my nose or touching my eyes, and that's when you get the germs. Right?
But if you're probably taking Loricidin, doing apple cider vinegar, and having vitamin D level of 50 to 70,
then you're okay.
You probably have a stronger chance of not getting sick.
Okay.
That's my take-home point.
That's your take-home. That's good advice. Do we have anyone tuned in who's asking? If you have any questions for the doctor, you can ask them now. If not, you should stop by and see him. He's located on the corner of Hayden and Cactus, and his number is above. And do you want to give everyone the address and phone number too?
Sure. My office number is 480-951-5006. I'm located northeast corner of Cactus and Hayden, just like Christine said. We're in the Odyssey Professional Center. My address is 8140 East Cactus Road, Suite 730. If you're Googling it, it's Scottsdale 85260. You can also visit me online at drburdorf.com. And if you want to learn about nutrition, you want to learn about my chiropractic neurology intensive programs, lots of information on my blog.
Okay, anything else you want to say to everyone?
Get your vitamin D level tested, stay healthy.
Stay healthy. Thanks everyone, give Mark a call.